If you do not skip the entire video, you can now get the important information. If you like the video, please like and comment. Share more important information with others. Acne treatments. This article was written and endorsed by the pharmaceutical company María Vijande. Acne treatments should be carried out from the moment they are identified. Therefore, it is important to go to the dermatologist at the first symptoms of this disease. Find out more about it. Luckily, today we have many quite effective acne treatments. This disease represents 25% of dermatologist consultations in our country. This percentage increases among the pediatric population and in primary care. It is a disease that develops by different factors, so it is said to be a multifactorial disease. Currently, we have a wide effective therapeutic arsenal to control each of the factors that are involved in the development of acne. However, to know the most appropriate option in our case, it is essential to know how this disease occurs and what are the triggers involved. In addition, as the American Academy of Dermatology suggests, we should also go to the dermatologist. In any case, then we want to make a brief review of this skin disease and the possible treatments that can be prescribed to combat it. Keep them in mind and solve your doubts with the professional. What is acne and why does it occur? What are electrolytes? Being such a common disease among the general population, surely you have already heard of it or even suffered it. Acne is a skin problem that occurs originally in hair follicles. The hair follicles are the part of the skin where body hair grows. During this disease, a kind of fat plug and dead cells are formed in these follicles. As a result, comedones, blackheads and pimples, the famous pimples, are usually formed, these being the main symptoms of this skin disorder. All these acne symptoms can appear in different parts of the body. However, the most frequent areas are the face, back, chest and shoulders. Acne is a multifactorial skin disease. It is characterized by the presence of pimples and pimples. On the other hand, regarding the causes, we have commented that it is a multifactorial disorder. Since there are many factors involved in its development, four main ones have been established. An excess fat production. Some bacterial infections such as that produced by Propionibacterium acnes. An obstruction of the hair follicles by accumulation of fat and dead skin cells. A high hormonal activity, especially of androgens. In addition to this, there are other factors that favor the onset of this disease and that aggravates it. For example, stress can make this condition worse, as well as certain medications and diet, as studies show. When and how should acne be treated? Acne treatments should be done as soon as the disease is identified. Therefore, when noticing the lesions, it is best to go to the dermatologist to determine the best option in our case before more severe symptoms appear. It must be taken into account that each type of injury has a specific treatment and, therefore, it is essential to have the diagnosis of the professional. Even additional tests may be necessary to determine their origin. The general treatment aims to reduce inflammation and prevent bacterial growth. Therefore, the treatment should be applied to the entire affected area, not locally on the lesions caused. Let's see below some of the most used acne treatments. Different treatments for acne. Depending on the purpose for which they are used, we can classify acne treatments into: directed to reduce the desquamation of ductal epithelial cells, fight bacterial infections, decrease fat production. The most commonly used drug is isotretinoin, which is a product of the metabolism of vitamin A. It is the treatment of choice when there is a risk of scarring. In many cases, in addition to the typical topical treatments, certain drugs are needed to fight acne. Acne treatments aimed at reducing the desquamation of skin cells. Among the most used treatments we can mention the following three. Tretinoin is a retinoid medicine that manages to normalize the obstruction of the follicle. It also has an anti-inflammatory and preventive action for the formation of the known pimples. Salicylic acid, it is less effective than tretinoin. It also has anti-inflammatory effects. Adapalene or tazarotene, these are new treatments with efficacy similar to tretinoin. Discover, what is salicylic acid? Drugs used to fight bacterial infections. Propionibacterium acnes bacteria is quite sensitive to many antibiotics. Among the most used drugs for this purpose we can mention the following. Benzoyl peroxide, especially associated with erythromycin. Clindamycin. Systemic antibiotics, such as doxycycline, minocycline or cotrimoxazole. Definitely. The acne treatments we have today are very varied. We recommend that you consult your trusted doctor or dermatologist to find out the best way to combat this disease depending on your case. Iridosis for acne, precautions. The use of iridosis for acne is being recommended by non-professionals. It is a trademark of the antibiotic erythromycin. Please subscribe to my channel. Click the bell icon to get the next update.